we have several projects in our department, but I'm working on one specific project by the name SPARK. SPARK is an acronym for supporting African communities in improving the mental health of kids with developmental disorders and their caregivers. So the main aim for SPARK is to co-develop an integrated community-based care model, promoting early identification for children with developmental disorders, and also supporting caregivers and creating like referral pathways for these caregivers.
Good morning, everyone. My name is Cheryl Moore. I'm a research associate with Site Savers. My research today is supported by a consortium of partners, some of whom are here. There's Humanity and Inclusion, Science International, Institute of Development Studies, and also we work with the county government. One of the activities that we do is we do an impact evaluation. We are currently working on an impact evaluation of inclusive ECD interventions in Homa Bay and in Turkana. We're working with 18 schools and we're looking at different sort of interventions and seeing whether or not they are working. Thank you. The high level takeaway, in my opinion, is since we've been implementing this work since 2021, we feel that inclusive ECD approaches is possible. We have been implementing this work in collaboration with the government and different stakeholders. So we believe that this is something that people can borrow and take home with them. Thank you.
Thank you. Good morning, everyone. My name is Deacon Somedo Chuka. I work for PATH in Kenya. At PATH, we do several projects, but for here, we are here to advance integrating nurturing care for early childhood development into health system. And today I'll be focusing on using facility exit interviews to improve integration of nurturing care at facility level. So over the years we have learned and we have good lessons because this ECD program we've implemented in CIR since 2012 to date. And my key takeaway or key item is that in all the programming, the solutions that we develop, let us put the providers, the caregiver into the center of everything to ensure sustainable solutions. Thank you.
Good morning, ladies and gentlemen. My name is Richard Miruka. I work for PATH. I'm here to present on how we are able to support adolescent girls, take care of their mental health, and also for their children. As we know, the teen pregnancy is high, but in more cases we focus on the girl and we don't focus in most interventions on the child. So how can we then also give support to the children? So my takeaway is that let us have targeted interventions that will target adolescent girls, their mental health, and also on parenting. Thank you.
Thank you. Good morning to you, Dr. I face that way. Okay. I'm told I need to face the trees there. Okay. Rosemary Molumbe from Daystar University, the coordinator, Institute of Child Development, and part of the planning team for this conference. Now, this study is a collaboration of one of our students, Judith Nabure, who's not here with us, but she's online, Dr. Geoffrey Kinuthia, and myself, and we sought to find out on the effectiveness of the guidelines used in daycare centers to protect children. And that was very key because of the challenges we see there, and to find out, do we already have some guidelines? And if they are there, are they effective? But to check the effectiveness was also to see the capacity of those who are implementing those, an actionable point based on our findings. Guidelines are many, and there needs to be a consolidation of these guidelines. But two, daycare center specific guidelines, because you have the ECD policy, but there isn't for daycare centers. And lastly, multi-sectoral working together. Thank you.
Thank you very much, panelists. That's very rich. I've got a few questions I'm going to ask each of the panelists, and I hope you're making notes to ask your own questions, please. So, Dr. Silas, I think you spoke very passionately about the needs of preschoolers and those who support children. So can you maybe shed some more light on what are some of the policy considerations and the implementation of learning through play among children with disabilities? Thank you.
Thank you, Dr. Anil, and thank you for that question. I think I'm so excited. Yesterday, we had the high-level leadership from the county governments of Kericho and also county government of Turkana here. I wish they could be around to sit down and listen to us presenting some of these most important findings from the field. But unfortunately, they are not on. But I think the great team is here to present this to them. One of the things that we are struggling with is having teachers' capacity built so that they can address the issues around disability. But before I get to the strengthening the capacity of teachers, I think we need to be spiritual when we are talking about inclusivity. We just need to mean what we are talking about. Most of us talk about inclusivity, but we don't even know the actual meaning of inclusivity. Having said that, our study showed that most of the teachers in the schools that we are working in did not have what we call the capacity to handle children with disability. As a policy issue, that is where we should start. I'm not saying that we train more teachers, but we need to build the capacity of the teachers that we already have so that they can include children with disability in their schools. The second thing that I have also found interesting as a policy issue is involvement of male caregivers. If you go to our preschools, it's all about ladies, all about women, and men are not existing at this. Men, you will find them at the higher level of decision making, which now find women are few there. So increasing the number of male working force at the preschool level is very important. The modification of learning and practice is very, very important in the implementation of learning through play for children with disabilities. Sorry. Yeah. Yeah. I said inclusion.
Sorry about that, just 1 minute.
Thank you. I said about the modification of learning and teaching materials that we are using. Children with disability might not use the normal materials that they have in school, in the preschool setup. Education will be very, very important. Finally, inclusion of parents of these children in decision making and also including the children themselves is also key. Implementation of learning through play for children with disability. Thank you.
Brenda, can you hear me? Okay. Brenda, you spoke about adolescents, mental health, and Dr. Silas, you've talked to us about the workforce and how important. Can you tell us how workforce can be supported more to be able to identify and refer children with developmental disorders?
Thank you, Dr. Neil, for the question. I'll mostly give my references to Spark. So one of the ways that the ECD workforce can be supported is, first, before I discuss that, most of the times when we talk about the ECD workforce, people consider that this may be our professionals alone, but that's not the case. The community are part of the ECD workforce, community health volunteers, caregivers, parents, all these are part of the ECD workforce, and in Spark we are really striving to involve all of them. So one of the ways that they can be supported is through training and capacity building. This could be training basically on disabilities. They need to know what are these disabilities, how do these disabilities present themselves, what are some of the signs and symptoms of these. For example, like what we do. Like what
Apologies for these technical hitches around sound. We have hardworking Kenyans who are trying to work hard. I can speak. I don't know if it is Brenda. Do we help her?
Like what we do in Spark, we have various trainings. We have the community support workers training, and when the community support workers that we are involving, we have the caregivers and community health volunteers. We also have a health care workers training. So we train them on the different types of disabilities as outlined by MHGAP. And the other way that they can be supported, maybe it's through sensitization and provision of the standardized skills for screening and identification. Like for Spark, what we do is we are trying to develop an identification tool that it can be used by anyone within that it can be used by anyone within the community, but specifically to identify children with developmental disorders. The other way that the ECD workforce can be supported, it could be through policy support, advocating for the different policies that support children living with developmental disorders. What we're doing in Spark is we've done a policy analysis of the different policies for children with developmental disabilities in Kenya and Sub-Saharan Africa. And we have an output. We have one policy brief. I have a few copies that I can distribute once the session is over. And from this policy brief, we have like policy recommendations that at least would help children living with developmental disorders. The other way, okay, thank you.
Thank you very much, Brenda. You've spoken about what the workforce is, how broad it is. And Dr. Silas, you've talked about the need. Sheru, you talked to us about the baseline and the many partners that you are working with. Maybe you could tell us a little bit about how you would describe the scaling up of this whole area. Thank you.
Thanks, Dr. Amin. Yes, I did talk about the inclusive ECD and how we're involving different stakeholders. One of the things that I'm happy some of my colleagues here have talked about is the involvement of the caregivers. So in this, the work that we are doing, there are a lot of things that all these stakeholders need to be informed about. For example, there's work with the parents. So the parents are usually taken through training and in different aspects of how to support their children with disabilities. And therefore, we hope that after the project, then they can continue with the things that they've been taught. The other thing that we want to do to ensure scaling is working with organizations for people with disabilities. The organizations that are based in Homa Bay and Turkana. And through working with them and training them and supporting them in advocacy activities and different other aspects, they are really the people that we would like to take forward some of these things. Working with the government also, ensuring that some of these training aspects, these inclusive practices are also involved. when we've learned that involving them from the beginning, since project inception to this point where we're actually doing the impact evaluation and looking at how these interventions are working for the children, that has been very, very crucial. And lastly, Dr. Silas has also mentioned the importance of involving the children themselves. In our work, one of the things that we do other than supporting the children is actually just seeking their consent. Because if we have their approval, if we do research and you just ask for the permission of the parent without asking for the permission of the child himself or herself, then that's sort of violating it, and they're not going to be happy about the situation. So involving all these different type of stakeholders, the teachers and the schools, we are doing school-based inclusion teams, meetings where we have sessions with the parents, the school administration, people from teams from the county government who come and have these regular meetings, so they are aware of how to support children with disabilities, and also how to support the teachers, how to support the parents, so that when the project leaves eventually, then it's something that they can be able to take forward, and we're hoping that that's something that will grow. Thank you.
Thank you so much, Sheru. You bring up 2 points which are very important. One is the monitoring evaluation and the ability to sustain something further. So with Dickens and Richard, who are both path, that tells me there's more than one path to early childhood development. So Dickens, you spoke about exit interviews. Can you maybe build a little bit on what we've heard in terms of the extent of public facilities to be able to integrate the nurturing care framework in the delivery of services? Thank you.
Thank you. Thank you so much, Dr. for the question. I think building on to what they've spoken about and actually looking at how integration is driven, the key component here in terms of ensuring successful integration is on training and capacity building of the providers. Especially that is the starting point. When we build the capacities of the providers, both at the facility and at the community, those are the community health promoters, then we will have successful integration. And this, when their capacity is improved, then they have a way of how to integrate this into the routine services, especially looking at the facility touch point, the ANC services, the MCH services, the OPD services, postnatal care. They have a way of how then they integrate this within the care seeking. For example, counseling of caregivers, responsive care, looking at monitoring of developmental milestone for the children, and then integrating that into the playbook sessions that are driven in the health facilities. So while we are working in CIR and having learned this has really supported them to improve the service delivery, and also even linking into terms of referral for children identified with developmental delays. So while at that, we also see that the current approach or the current agenda in terms of DHT, digital health platform, we also have an opportunity that we can advance to promote counseling and improve caregiving at the community using the ICHIS. That is the Community Electronic Health Information System. Thank you.
Thank you very much. So Richard, you spoke a little bit about mental health issues. You spoke about how we are going to look at that environment in the early years. Maybe you could tell us about how we can actually ensure that the mental health of adolescent mothers is actually given the attention it requires in very concrete terms. Thank you.
Thank you so much, Dr. And I'm so happy to share based on the findings that we got from the field on the pilot on the parenting program that we did in Homa Bay. We did this one with the KMET, USAID, Nuruya Mtoto, and also with the Chaka Chaka, which is Paths program also. These particular programs target adolescent girls on the DREAMS program. And one key thing, how the program was, we had sessions that the girls could share, like we had weekly sessions. So every week, the girls had opportunity to share on things that could make them happy, things that could make them sad. And at the baseline, we had done PHQ-9, that is Patient Healthcare Questionnaire, just to have what is the depression or the mental health of these particular girls. And when we were able to do the end line, based on the interventions that these girls could share on a weekly basis, some of the things that will make them happy, some of the things that will make them sad, and they could have avenue to share, we did realize that the depression rate among these girls had come down. And so the recommendations that we have, based on the findings from the field, is one, we need to have psychosocial support groups for these particular girls, whereby they are able to share as peers, and as they share, then it will help them. Secondly, we did realize that we needed to integrate the economic empowerment to these girls, because we did realize that most of the girls, because they don't have money, we could build their nutrition knowledge or on child development. But again, they remember back at home there is nothing that they are going to eat. So from the field, we felt it that it will be nice if we can integrate economic empowerment with these interventions that target this particular girl. So we take care of this child holistically. Then we also learned that we need to capacity build the healthcare workers so that they integrate the aspect of mental assessment within this particular age group into their routine services, so that you're able to identify them in time, and then those who have been identified, you are able to give them targeted services, like you can provide counseling, and also you are able to give them the support they need. Lastly, we also did realize that it will be good if we establish what we call youth-friendly services. So every facility need to have a youth-friendly services, and then we can have safe spaces where they can always come and they're able to share. So those are some of the key findings that we were able to get from the field. Thank you.
Thank you very much, Richard. Dr. Olumbe, these young researchers, these knowledge generators are really challenging our generation. Yes? So you can see how young all our researchers are here. And they're actually breathing, believe it or not. I keep reminding them to breathe. But Dr. Olumbe, you spoke about the various policy domains. We've had good policies, but maybe you could share with us, based on all the things we've heard, what are some of the issues in the implementation of all these policies, particularly to reach the most poor, the most disadvantaged, and the ones that we've been focusing on today, those with disabilities? Thank you.
Thank you very much, Dr. I'm told I have to stand, so I'll lecture. Anyway, so when we talk about the issues that we have in the implementation of these policies, and they are there, and they have been found to be utilized. One of the things that we see as a problem is the lack of capacity, especially for the implementers. And for example, in our study, as we try to look at the managers in the daycare centers and the caregivers who are there, almost 80%, not almost, but this is from the finding, 80% had not received relevant training in terms of the guidelines or policies or how to take care of children. But 60% had never been trained in that, rather did not know that there were policies that existed on safeguarding of children, and that's a worrying trend. So implementation because of capacity. But secondly, there's the issue of resources. So how much resources are we targeting for daycare centers, maybe at the county government and the national government level? So as much as they would like to give the best for children, they lack the adequate resources to do that. And how can we resource, therefore, the ECD section and the daycare centers for that? Thirdly, and what we seemed to find was now going to the institutional capacity. And we found that a number of the places had no sufficient space for play as outlined in most of our guidelines. So they did not abide with the guidelines. So no sufficient space for play, whether indoors or outdoors. Lack of sufficient latrines for children, and that's a public health issues, and that still goes back to the institutional capacity. But I'd like to highlight out again what is the other challenge that we experience here. The challenge of monitoring these ECD centers, but specifically the daycare centers. So we established there are quite a number of ECD centers that were there and they're not registered. So who's monitoring on the ground level? Lack of registration therefore means the daycare center does not operate within the guidelines. So the monitoring and the regulation is very key for the success in the implementation of this. And maybe finally I would highlight many policies that are segmented. How do we harmonize these policies and have something that is very specific, that will be easy to be chewed, if I use that word, consumed at the very lower level, so that safeguarding of children is actually very effective. I think I brought in one thing, the multi-sector. I think many times when we talk about the daycare ECD, we are focusing on education, but it's more than that. How would we have the different organizations be able to speak to the issue of implementing these policies? Thank you very much.
Thank you very much, Dr. Lumbe. I would like to take one burning question from the audience. Just one. Who is going to be brave enough to tell us they've got a burning question? Yes, the lady over there. I saw you first. Yes, you can just stand and ask your question. It's a burning question, so she needs to be in the sun.
Thank you. Thank you, Dr. Olumbe. This question goes to, thanks to all the panelists. I just mentioned something that made me jump where I was sitting. And you said 80% of caregivers in child care centers are not trained. They have no idea what ECD is, what child care, nurturing care is. So what are the plans for the government? Whose responsibility is it to train these people? Thank you.
Thank you. So I know there are many burning questions. You see, we have very young researchers. They have a lot of energy. Please, please come to them and speak with them. I want to conclude on 2 points. One is that the monitoring, the evaluation is critical, but more important than the monitoring and the evaluation is the learning and the development of the program as it is going on. Not waiting for the evaluation after the program and saying what we got wrong. And the second point is that our communities, our children, they are not just the recipients of services. They are also our co-creators. They are also the people that are researching. They know their systems. They know their needs. So let's work with them for systems responses. Let's not wait for the children to come to the service. Let's make sure the service is developed to meet the children. That's what the research is telling us. So I'm going to ask these very young researchers to stand up and thank the audience for listening to us so very carefully. You can make your way out. Thank you very much.
Let's Twashukuru kwa kuwa wametu. Have we learned from that particular session? Have we? Very good. I have a question. Please answer it if you don't know. The question is this. We talk about daycare centers. Sindio? Do we have night care centers? We have night care centers. So the day needs care and the night needs care. Oh, it is the day that needs care and the night that needs care. Who needs care? Who needs care? Can we name it correctly? What was devolved to the counties? Were you devolved child care services or daycare services? Hello, ebu enda kwa constitution tena wewe. What was devolved? Child care facilities, ndio? Na mkuambiwa mwende mwanze kuita daycare. The day doesn't need care. It is caring for itself now. It is the child. Focus on who? Then you will answer all those questions. Panel 2, Mnaweza and your team. All those panelists, please come to the front very quickly. And at this moment in time, allow me to acknowledge the presence of our first ladies. Ebu tuwapatie ile shangwe yetu ya kutoka huko juu. First ladies, karibuni sana. The first lady of Turkana is here, and the first lady of Nyandarua is here. They were here from yesterday. Isn't that commitment? Haya, sasa tuwapatie ile makofi ya kutoka kwa Waluya. Wajua ile ya kutoka kwa Waluya? Haya, nikifanya hivi unapiga. Hii ni kuku inafanya kazi. Sasa nilikula asubuhi chicken wings. Haya, tuanze. Moja. Hapana, enda na mimi. Moja. Mnafuata mimi. Moja. Haya, ya pili.